Hello, everyone. I'm just going to share my screen. Okay. So I did my presentation on Springfield, Vermont, which is the town that I currently live in. And my conclusion is that it's a town that's on its way to becoming recovery ready, but isn't quite there yet. So throughout this course, we've been learning about what a recovery ready city or recovery ready community is. And it has four main components: access to comprehensive treatment, employment opportunities, including a recovery ready workforce, safe and stable, sober housing opportunities and affordable housing, and educational opportunities. So a little bit about Vermont in general. This graph shows the number of overdose deaths that have occurred from 2010 to 2021. As you can see, they are steadily increasing. There was a little bit of a dip in 2019, and then COVID happened and they started rising again. A lot of this is definitely due to the rise in fentanyl that's present in heroin. Vermont has one of the lowest rental vacant rates in the country. It's at something like 1.3% of all housing stock is available, when a healthy market rate is about 4 to 5%. It also has the second highest per capita rate of homelessness, second only to California. And Vermont is known for really being hit hard by the opiate epidemic. It is a very rural state. It is a state with a lot of poverty. In Windsor County alone, the county that Springfield is located in, about 5,000 people, or about 10% of the population, lives under the poverty line. And there are many more people who may technically be above the poverty line who are functionally very much still in poverty. So all of these things contribute to a rise in substance use disorder in this area. To receive treatment for SUD, residents have to be 12 years or older. And this was very difficult to find out. No one really seemed to know, but it appears that you have to be 16 or over in order to receive any form of medication-assisted treatment. A little bit about Springfield in general. It has a population of about 10,000 or so. It's known as the home of the Simpson family. That's our thing. It was also an old mill town and machine tool factory hub. This building on the right here is that used to be an old factory. Not all of our buildings look like this. I would say that that's definitely the worst one. But it definitely shows that there is a lot of deterioration in the town, and there's a lack of employment opportunities. When the machine factory hub left in the 1980s, it took about 3,000 jobs with it, but there has been a lot of efforts to revitalize the town. So looking back at Jacinta from this course, what did she need for a successful recovery? And do those things exist in Springfield? And would she have been able to recover if she were to have lived in Springfield? So I would say that she would need a comprehensive individualized treatment plan, ideally with a collaborative care model, which we've discussed in week 8, a recovery-friendly support network, and a peer support coach. And Springfield has actually been really good about having a strong peer recovery coach community. Third, a recovery-friendly employment opportunity and educational opportunities. and individual therapy and potentially family therapy, along with other healing modalities to address the trauma at the root of her addiction. So here are the relevant resources that exist in Springfield. There is an outpatient rehab, Sevita Health. They do have MAT available there, but just Suboxone and naltrexone and things like that. They do not have authorization to provide methadone. There is no inpatient rehab facility, so there is only an outpatient rehab. There is an inpatient rehab about 45 minutes away in Brattleboro, and a lot of people who need that service will go there. Turning Point Recovery Center, which I'll talk more about in the next slide. They offer a lot of peer coaching and services, and they're a recovery-led organization. They hire people in recovery, and they're just a really great community resource. There are some privately owned sober houses, which I'll talk more about. There's a Springfield Hospital, which includes physicians that are trained in administering MAT. There's the West Lebanon Habit OPCO, which is the only nearby methadone clinic, which is a little more than a half hour away from Springfield. It's actually in New Hampshire. There's HCRS, or Healthcare and Rehabilitation Services. They offer counseling and case management. They're probably the biggest mental health organization in the state. They have an office in Springfield, but they also have an office in a few other towns as well. And they offer a lot of support, especially folks who are coming out of homelessness or coming out of treatment and need comprehensive case management. And then there's also the Mobile HIV Center, which I had no idea existed before researching. I wasn't sure that there even was any sort of syringe exchange or fentanyl testing in town, but they do offer this. They don't have an office, but they'll go to you, which I think is pretty cool. You can fill out an anonymous form on their website and they'll bring you the supplies that you need. They'll meet you at a centralized location or they can leave supplies for you and they'll take back your used supplies too, which I think is so important, though I feel, and I'll talk more about this too, that there needs to be a more widespread distribution of Narcan and more awareness building that these services like this exist and that you can test for fentanyl, because the overdoses that still happen in Springfield have been mainly because of fentanyl. So if more people have access to this or knew about this resource, perhaps that could be prevented. So the first resource spotlight is Turning Point. And I interviewed a staff member, Astrid, who is the COO of the Springfield Turning Point Center. They have a few different locations in various parts of southern Vermont. And Springfield is in southern Vermont, bordering New Hampshire and Massachusetts. So like I mentioned, they have peer recovery coaching. They have about 20 employees and all of their staff have been in recovery themselves. They hire people who have used their services, which I think is really cool. It gives people in recovery an opportunity to give back to their community and gain stable employment. They also have a program similar to the Options Liaison program, which is organizational outreach, where they go into the communities and are embedded in different community locations like police departments and things like that. And they provide advocacy and education and work with people one-on-one at any stage of recovery. They also have tons of meetings for people who identify with AA and NA. They do have that, but they aren't necessarily affiliated with that. They also have things like community dinners for people in recovery and group hikes for the recovery community. And they really work to destigmatize being in recovery and try to normalize it, which I think is cool. The second resource, and there's not a ton of information about this. They don't have a big website or anything, but it is such an important organization for people who need to access their resources. Habit OpCo is the biggest area outpatient rehab, and they're also the only certified methadone clinic. And I'll talk more about them a bit, but even though they're so important, because they're the only methadone clinic, there really needs to be one in Springfield, but there are laws that dictate how far away each methadone clinic has to be from each other. But again, for people who utilize that form of MAT, it's a really important resource for them. So what are the barriers to becoming recovery ready for Springfield? This is a quote from the person I interviewed with. And she said that by far, access to well-managed, affordable, and safe sober housing is by far the biggest barrier for folks in recovery in Springfield. So yeah, I would say that housing is definitely the biggest barrier. Although there are sober houses in Springfield, a lot of them are not well managed. They're run by private landlords, and there's issues of safety and cleanliness and things happening there that make residents feel uncomfortable. And so, if someone is in recovery and they need access to sober housing, are they going to want to go to a sober house where they've heard bad things about because it's a small town? Another barrier, like I mentioned, is the lack of a methadone clinic in Springfield, and also a lack of physicians generally, but also physicians who are knowledgeable in administering any form of MAT. And then the third barrier is a lack of recovery-ready workplaces. There's a lot of stigma that exists that I spoke with Astrid about. People who are in early recovery need to go to lots of meetings. They might need to go to the methadone clinic every day or every week, needing to go to outpatient rehab, and there just needing to be a lot of flexibility. And so employers are not really ready to be to have that flexibility, even though it is quite worth it to hire people in recovery, and it helps everyone in the community when you do so. So those are the biggest barriers. With the Jacinta case vignette in mind, is Springfield recovery ready? So like I said in the first slide, I believe that Springfield has a lot of resources available for being such a small town. It does have a lot of organizations who specialize in recovery. A couple big organizations have office spaces in Springfield. There is a mindset generally of people knowing that addiction is a disease. However, there is still quite a lot of stigma. There are not enough resources, there's not enough housing, there's not enough economic opportunity and educational opportunities for it really to be recovery ready. Reflection and advocacy. I am pretty new to Springfield. I just moved here in May of this year, and before that, I was living about 45 minutes away in Brattleboro. So this was very interesting to me to learn more about this community that I live in and really get a sense of where it's at in terms of being recovery ready. There are some things that surprised me and some things that did not. I was not surprised to hear that housing is one of the biggest barriers. I was surprised to hear that they did not have a methadone clinic and that there was a lack of access to MAT for people. And so in advocacy, access to more housing, safe, sober housing that maybe it's run by organizations with a high standard of care. I would love to see the ACT model implemented in Springfield, which is implemented in Brattleboro, and just less fragmented care for people generally. I think that it's important to advocate for anti-poverty measures. For instance, there is a public forum coming up in just a couple of days, actually, for baby bonds, it's called. And so this is something that Vermont might implement, which would entail setting aside a little over $3,000 for each baby born on Medicaid in Vermont. And then the state would invest that and people can access it once they're 18 all the way up until when they're 30. And so that is a range of $11,000 to $24,000 that they can use for a wealth building activity like buying a house or retirement or education or starting or investing in a business. And so this would have a huge impact on generational poverty. And since generational poverty and trauma are so interconnected to addiction, initiatives like this have a really good chance of stopping addiction in its tracks and preventing people from becoming addicted in the first place. And these are my references. Thank you so much.